Hello, good evening. This is Dr. Parijat Kumar, the Director of International Sports and Orthopedic Manual Therapy, ISOMT. Welcome to the answers and the solutions for golf webinar quiz. I hope you attended all the questions and you were able to secure the passing marks. All right, so let's get on to the answers and the solutions for today's golf webinar quiz. The first question was, what two main swing faults were discussed by Dr. Reginald in today's golf webinar? The correct answer to this question is early extension and loss of posture. The first option. Yes, that's the correct option. These are the main errors that we really find in swing faults, which is the early extension and loss of posture. The second question was, and it was like a general question, the second one, that do you really think, and we asked you to be honest to yourself, that you are currently studying, this is out of the golf webinar quiz, but are you really studying, teaching, or practicing a worldwide current evidence-based and ethical practice or a program in your community? We wanted to know, what is the definition of you doing a evidence-based program? If you answer yes, we would definitely like to know your resources and what kind of level. If no, then what more we can do to help you to practice more evidence-based. All right. The next question was, which of the following characteristics is not generally seen due to swing faults? The correct answer to this was the third option, is difficulty holding a club and generating upper extremity strength. We see a lot of thoracic stiffness, a lot of hip problems and dissociation problems between the pelvis and the thorax. So the correct answer to this is third option, difficulty holding a club and generating upper extremity strength. Next question was, which of the following range of motion deficits has to be commonly seen in the lead hip? The lead hip, and when a golfer is hitting a golf shot, the lead hip actually internally rotates. So it is the internal rotation hip range of motion deficit that you will see most commonly. Next question is, which body is generally responsible to generate most rotation? And this is a general question, not only in a golf swing, but actually most of the rotation in your spine comes from your thoracic region. So the correct answer is thoracic spine. All right. The next question was a general question again here, where we want people and participants to mention their 5 key areas that they think they are lacking as a student or a clinician or a professor in their organization or a community. We don't want to kind of name the organization or any particular person. We keep all the identities confidential, but we would like to know that what is actually stopping you over here. What are the areas that you need to work on, whether the resources, the education, training. We would like to know from you. All right. The next question was, having hypomobility in thoracic spine can lead to hypomobility in lumbar spine. It's a true and false question, and the answer is false. A hypomobility in thoracic spine can actually lead to hypermobility in the lumbar spine, and that's why there are many low back pains. The next question was, according to the regional interdependence, which of the following limitation causes impact on lumbar spine and sacroiliac joint? The correct answer was hip range of motion. We have discussed this many times in our webinar in the past, that hip is actually directly related with your back, knee, sacroiliac joint. So actually it is the hip. So coming to our next question, mobility issues should be addressed before the stability issues. It's a true and false question, and the answer to this is actually true. You need to address the mobility issues in the golfer with the thoracic spine and the others before you address the stability issue, because stability is another different webinar or a different chapter altogether. Next question, when your hip is in neutral, what glide will help to increase the hip internal rotation? And this is a common thing. If you people out know your arthrokinematics, you know that in order to increase the hip internal rotation, we need to push the hip posteriorly. So the posterior glide here is the correct answer, which is the first option, to increase the hip internal rotation. All right. According to few studies, next question, Lindsay and Horton, male golfers who are right-handed tends to have more lumbar what when addressing the ball during the golf thing? So the answer to this is actually lumbar flexion. Why? Because I mentioned to you, because if they're having thoracic stiffness, that is leading to lumbar hypermobility, and there was this study done which showed that because of these multiple issues and regional interdependence, the golfers which are right-handed have shown to be more lumbar flexion, and they have the contralateral side flexion. So the correct answer to this is actually flexion, first option. All right. The next question was, which of the following objectives were not discussed by Dr. Regd today, Dr. Reginald? So he discussed all those objectives, like how to assess the golfer from a mobility standpoint based on the TPI assessment and all, how to correct these through a manual techniques. He showed some manual techniques like manipulations and corrective exercises. The correct answer to this question is the third option, that why the knee is the most common area of injury in golfers. It is actually your lower back which is the most common area of injury in the lower back. You might have knee issues, you might have ankle issues, you might have wrist issues, you might have multiple issues. But the most common area to be injured in a golfer is actually a lower back. So the correct answer is the third option, that knee is not the most common area for the golfers. All right. So that was all the answers to our questions and solution. I hope you secured good marks, and we'll get you the certificate in 24 to 48 hours on your email ID. We would like to hear from you. Our next two questions was to please tell us about what more webinar topics we can take, and you can rate us on a scale of 0 to 10, 0 being not good and 10 being like the excellent. And we would like to hear your feedback and suggestions on that. All right. Please stay tuned and keep learning through ISOMET. Thank you so much.